Good afternoon. I'm Dr. Deepa here. Today I will discuss something about the ophthalmoscopy, especially the direct ophthalmoscope that may help the first year PGTs. It's very much needed when you first join your DO course or MS course. Ophthalmoscopy basic and advanced. Direct ophthalmoscope, it is a handheld instrument used to examine the fundus. Obviously, it is used monoocularly. It examines the central 10 degree of the retina, and the magnification here it's 15 times. These are the pictures of direct ophthalmoscopes, various types. Now, direct ophthalmoscope consists of two systems, illuminating system and viewing system. There are various rack of lenses of different powers, and these are for refractive state of both the examiner and the patient. This is the picture of the ophthalmoscope for very close one, on and off button, and there is a switch for focus. There are certain apertures. So in the later slides, we will discuss about the function of various apertures. In the ophthalmoscope, as I told, there are certain apertures like a large one, small one, strict, and a fixation star. There are certain filters also, red free filter and cobalt blue filter. Now, these are the diagrams of various types of aperture, and these every aperture have got an importance while examining the various types of patients. It may be a large, it may be a medium, small, half, red free light, slit, blue light, or green. Now, the large, medium, or small light source. So, this will depend upon the dilatation of the pupil. Which type of size we will use, it depends upon the pupillary dilatation. Otherwise, it may create difficulty while examining the patients. Now, actually, the small light is used when the pupil is very much constricted. The large light is best when the eye is dilated with a mydriatic drops and eye is full dilated. Usually, we do ophthalmoscopy in a dark, non-dilated pupil with the medium size light. Half light is the importance of it is pupil if it is partially obstructed by a lens with the cataract, then we can take help the use of this half light. Half circle can be used to pass the light through only the clear portion of the pupil to avoid light reflecting back. What is the use of the red free light? So it is used to visualize the vessels very clearly and the hemorrhages in better detail by improving the contrast. This setting will make the retina look black and white and gives a very proper visualization. What is the use of the slit beam? It is used to examine contour abnormalities of the cornea, lens, and the retina. Blue light, in some ophthalmoscope we see blue light, and it is used to observe whether there is corneal abrasions or ulcer after fluorescence staining. Suppose we do not have slit lamp, then we can stain this corneal abrasion or ulcers, and we can use this blue light to see the patient and get some idea. This is the method how do we do this ophthalmoscopy. We ask the patient to fix at a distance, we fix the head, and we do the ophthalmoscope from distance to the near. So as I was saying, use your right hand and your right eye to look at the patient's right eye and vice versa. First, we make it to +10 to view the anterior segment like cornea. Then, as you approach to eyes of the patient, shift the lenses to 0. First, we focuses at the cornea, then the lens, and then the fundus. If the examiner and the patient both are emmetropic, then the lens strain will be 0 and we can see clearly with the 0. The closer the examiner is to the patient, the larger will be his field of view. So, examiner should be very near to the patient while doing the ophthalmoscopy. We see a straight image and not inverted image as we see in the indirect ophthalmoscope. Now, before that, initially, the students should use a dilating drops to dilate the pupil and do the fundoscopy examination practice. Then, after a certain period, they can do the fundoscopy without using the dilating drops. So, we usually dilate by the certain mydriatic drops. So, in general, we use tropicamide and it is considered a very safest one. Dilate one eye when you start your examination and by the time you will ready to examine the patient is full dilated. We actually use as I told, the tropicamide and the cyclopentolate, 1 or 2 drops, 15 to 20 minutes before the examination, and we can repeat it every 30 minutes. Now, what does they call? They paralyzes the circular muscles of the iris and causes mydriasis and also the ciliary muscles and causes loss of accommodation. Now, while using this tropicamide and cyclopentolate, so we have to just take history of certain whether the patient have the history of any hypertension or whether the patient is pregnant, all these things to rule out the various diseases. We can also use atropine 1% solution, and for atropine we have to instill 1 to 2 drops 1 hour before the procedure. Next, we can use homatropine, 1 drop of 2% solution immediately before the procedure, and then we can repeat at 10 minutes interval. Sympathetic agonists like phenylephrine that can also be used. Now, so while we are doing the ophthalmoscopy, we have to keep it in mind what we are actually examining. So we have to examining in case of disc the shape, the color, the clarity of the margin, the cup disc ratio and venous pulsation. Very important sign. Oh, it is absent in 20% of normal population. Now, regarding the fovea, fovea actually gathers the light from the ophthalmoscope and presents as a very sharp reflex that is called foveal reflex. So we have to record whether the foveal reflex is present or it is absent. Macula is examining for if there is any elevation or edema, if there is any pigmentary changes or not. Now see, this is the picture that is describing what are the structures we should keep in our mind while examining the ophthalmoscope. That is the optic cup, the optic disc, disc margin, the veins, the artery, the macula and the fovea. So this is a I am trying to showing the venous pulsation picture. Next, very common diseases that we used to get, that is the hypertension, the diabetes, and the glaucoma. So, in hypertensive retinopathy, we have to isolate it, the various grades that is showing in these diagrams. Then this is the picture of the disc showing a very pale disc. You can see the difference between a normal disc and a very pale disc. Next, it is showing the diabetic retinopathy, the hemorrhages, dot blot hemorrhages, microaneurysms. This is a very moderate to severe non-proliferative diabetic retinopathy showing the exudates, cotton wool spot, dot blot hemorrhages and microaneurysm. This is also a features of proliferative diabetic retinopathy. See the pictures of the new vessels over the disc and the new vessels elsewhere. So these structures, while examining, you have to keep in mind. So you have to see what we are trying to see while doing the ophthalmoscopy. Next, see, this can be found both in the diabetic type of retinopathy or in case of hypertensive retinopathy. See the features of cotton wool spots, then hemorrhages, then hard exudate and the microaneurysm. With these slides, we can see the difference of these features. What is cotton wool spot, hemorrhage, hard exudate and microaneurysm. And the last slide is showing the difference between a glaucomatous disc and a normal disc. So with this, I am ending my presentation. I think you will get benefited with these slides when doing the ophthalmoscopy. Thank you.